it's Dr. Margot R. Emami of RAMD, and the other day you saw me do an Embrace RF procedure in my office, and you saw the internal part of it, and I showed you what the device looked like, and today we're going to be doing the external part of it, or the MORPHEUS 8 is what it's called, and that's kind of like micro needling and resurfacing and retexturizing, skin tightening, addressing melting fat if that need be, all in one device. And today I have Suzanne with us, and we're going to be doing Embrace RF, the external part of it on Suzanne. And Suzanne, tell me a little bit about why you wanted to have this procedure.
Well, I'm 54, and just in the past few years I've noticed a lot more kind of aging around my neck and my cheek areas, and I'm in the public eye, or I'm, have a job where I'm seeing the public every day, and it's just started to bother me more and more. I had a bad experience with a filler many years ago, and I had a reaction to it. So I was looking to Dr. Emami to be able to do something that didn't involve fillers and was more natural. So that's why I'm here.
And we're glad that you're here, Suzanne, because we're going to be doing some really fun things today in addition to the MORPHEUS. So Suzanne is in very good shape. She's very thin. She really doesn't have any extra tissue here underneath her chin. So we're really just going to be looking at retexturizing this little area that we all kind of get from environmental exposure in sunny San Diego. And then we're also going to be dealing with what most women really dislike as we get older, which is kind of this little fine lines and wrinkles and jowling. And so we're going to be addressing all of those areas. And MORPHEUS is going to retexture these fine lines and wrinkles. It's going to lift the skin, and it can melt fat if you need it to melt fat, although Suzanne has no fat to melt, so we're not going to be doing that on her today. MORPHEUS we're going to be doing on the lower part of her face and this part of her neck. Now, it can be used on any part of the body that you would want to do these same things to, so it's incredibly versatile, and that's what I love about this technology. And so this is what the device looks like. I just want to show you. It's just a little handle, and then out through this little handle comes these little very fine radio frequency pins that emit energy deep into the dermis and into the fat as well if we vary the depth for it to do that. Now, it's really wonderful because we can vary the depth and we can vary the energy. So you can make it a very light treatment, or you can make it a much heavier treatment depending on what your needs are. So we're going to do a fairly moderate treatment on Suzanne today because she really wants to address these fine lines and wrinkles, but we're going to be keeping the depth at a more superficial rate because she doesn't have any fat to melt at all. But if we needed to melt fat, say on the knees or in this little axillary area, we could do that. Now, this is not a painful procedure. We have some topical numbing cream on Suzanne, and then I'm also going to be giving a little lidocaine in addition to that in the skin now that she's nice and numb, so it's very comfortable for her. I'm a huge fan of platelet-rich plasma. I use that on pretty much all of my resurfacing procedures. If you want to use stem cells, we do offer that. Now, you don't have to have that. That's really kind of an add-on and a personal choice. Why Suzanne wants to have stem cells is that it's really going to help the signaling of her own cells to recruit her skin cells to make more collagen and elastin and to heal more quickly. And theoretically, that's what we believe is happening with the growth factors and the signaling factors that are inherent in stem cells. And we want to kind of wake up her own ability to produce collagen and elastin. So as I said, I pretty much always use platelet-rich plasma, which is your own growth factors. I drew Suzanne's blood and we're spitting it down the lab, and we're going to be injecting that at the end of the procedure for healing. Any thoughts about any of that, Suzanne?
It just sounds really exciting. I'm really looking forward to the results.
Yes, me too. So we'll keep you posted on our next stage when we show a bit of the procedure. Okay, so we're doing Embrace RF, and we're doing the MORPHEUS 8 part as I promised. And Suzanne, how are you doing?
I'm doing great.
So we did a little bit of topical numbing, and then I injected a little bit of lidocaine as well. And I've done her neck already and part of her lower face. And then we're going to be doing another pass on the face. And we're going to finish up with some Fractura, which is kind of the baby sister of MORPHEUS 8. Fractura is a little bit more superficial and takes care of those really fine lines and wrinkles and gives you that beautiful skin texture. So I'm just going to show you what a little bit of this looks like. Suzanne, do you mind just turning your head to the left? And as you can see, Suzanne is completely awake. She's fine. She has a little bit of redness just from the procedure, which is what we want. We want it to look that way. That way we know we're getting a good treatment and it's nice and even. And the PRP and the stem cells will also help to accelerate her healing. So I'm going to show you here on the lower part of the face what this is like. Okay, ready, Suzanne?
Yes.
Okay. So you can see it goes really fast. Suzanne, how does that feel? Is that tolerable?
That's fine, absolutely.
It's really important to me that my patients are comfortable. I do not believe that you have to suffer to be beautiful, and so being comfortable and it being a procedure that you're willing to do again or willing to recommend, and that you feel like you made a good choice is really important. So we're going to complete our Morpheus 8 procedure, and then we'll follow Suzanne along the way and let you know how she's doing with her progress. She's going to wear ointment for about a couple of days, some healing ointment, and then after that she's just going to put on sunscreen and makeup. She'll have a little bit of redness and some swelling for about a week, but it's really well covered with the makeup, especially the medical grade makeup, and goes away very quickly. And then she'll start to see really a change in the skin at about the month mark. It'll get better at 3 months, 6 months, and even up to a year. So it's kind of the gift that keeps on giving. So we're at the stem cell PRP part of the procedure. We finished with the Morpheus 8 and doing Fractura over top. Suzanne, how are you feeling?
Great.
So here's how the stem cells come. And then what we're going to do is we're going to draw this up very carefully into a little syringe, and we're going to add it to Suzanne's PRP. Okay, now we've prepared the PRP and the stem cells. So you can see it's about 5 cc's, and this is Suzanne's platelet-rich plasma mixed with the cord blood stem cells. And we've already put some topical PRP all over her neck and her face, and now we're just going to very gently inject all of this. And she's numb from what we did before topically, and so I'm just going to just show you what that looks like. Suzanne, if you wouldn't mind turning your head all the way to the left. And then we just do these little tiny injections. You know, now if you've heard of vampire facelift, all that means is that we're using platelet-rich plasma to help the skin to regenerate, and that's really what it means by vampire facelift. It's not your blood, there's no red blood cells, it's just platelet-rich plasma. And then this is that with the addition of stem cells. You can see we just do these very baby, nice little gentle injections, and Suzanne is quite comfortable throughout this because she's nice and numb, so she's not really feeling it. And then we're going to continue to do this in all the areas. That is the completion of our Embrace RF Morpheus component combined with some regenerative techniques. So once again, this is Dr. Margot Emami of RAMD, and we will show you more of Suzanne's progress as time goes on.